the management of all patients with cancer in the midst of a pandemic, and this pandemic is incredibly challenging. With regard to our breast cancer patients, I think that one of the things we have learned is that there is a lot that we can do virtually. And we have been making great efforts to keep in touch with our patients. And we are so grateful to have that technology to at least be able to see each other face to face virtually and be able to conduct our regular visits at the same interval we always would, albeit maybe not in person. I think the other thing that we're doing is taking great precautions, both in our clinical settings where our breast cancer patients are frequently coming to, like our laboratories, our CT scanners, and our infusion centers, just to make sure that patients are appropriately socially distanced, that everybody is wearing a mask, to make sure that the areas are as sanitized as they possibly can be to avoid the spread of infection. And I think that we're going to have to think creatively in the future, now that we assume that COVID-19 will be a part of our lives moving forward for at least the next, several months, if not, years. And in just how we keep our patients as safe as possible. And some of the things that I know many centers, including ours, are thinking about are just the staggering of patient visits so that we can keep people appropriately socially distanced, and the continuation of virtual care so that for those patients that do not require a visit to the cancer center, that we're able to do everything we would have done in person, virtually in some select circumstances. The other thing is just, I think, minimizing patients' time in the cancer center. I know a lot of times we would bring patients in and they would have an appointment, and then, maybe several hours later they would have their blood draw, and several hours later they would have their infusion. And we're really, really trying to do things to consolidate and compress that amount of time that patients are coming into contact with the healthcare system so that they are at lowest risk of infection.